morning, everyone, and thank you for joining us for this session of Breakfast at UMHealth. It gives me great pleasure to introduce our speaker, Dr. Khoo Vien. Dr. Khoo is our newly minted developmental pediatrician. She started her training in developmental pediatrics in September 2020 here at UMMC, and then she went on to do a year at the Royal Children's Hospital at the Centre for Community Child Health. And Dr. Vien will be talking about play and the importance of play in children. So we'll take questions at the end, but please enter your questions in the Q&A section so that Dr. Khoo can take them at the end of the session. Thank you. Over to you, Vien.
Thank you, Prof. Subha. I'm just going to share my screen. Okay, I hope all of you can see the screen, and I'm just going to get started. So I will be talking about the importance of play in children. And to start off with, this child here is Dania. So I met her. She's a 12-year-old girl. I first met her at the pediatric outpatient clinic, and she presented with a history of headache for 3 years. So since she was 9 years old, she's been having this on and off intermittent headache. And look at her schedule. So I delved deeper into what she does on a daily basis, and this is what she does. So she wakes up at 5:30 in the morning to get ready for school, and then school is from 7:30 to 1:30. Then she'll have lunch. So every afternoon she goes for tuition for 2 hours. And then at between 4 to 6 dinner time, she catches up on her sleep because, as you can see, she only sleeps at 12:30 at night. And she has a little bit of free time at 6. And then from 7:30 p.m. onwards, she has to finish her schoolwork because she goes to a Chinese school, right? So this is such an extreme example of a child's daily schedule, but this is kind of the extreme end. But in my course of seeing patients in clinic, there are many children who live their lives like that, right? So it makes me think about how much play we're actually giving to our children and whether more is better.
We've been sold a story that more is better when it comes to children. More toys, more enrichment classes, more activities. But the truth is, children don't need the more. They need time and space to explore, to move, to play, to do nothing, to be with others, to just be.
Yeah, children need the time and space to just be, right? So children have a right to play. So the UN Convention on the Rights of the Child states in Article 31 that every child has the right to rest, relax, play, and take part in cultural and creative activities. So what is play? So it is the child's process of engaging and interacting with the world around them. It is a goal by itself, so it may appear to have no intended serious or practical purpose, but it serves a purpose for the child who is playing, right? So play needs to be freely chosen, undirected by others, intrinsically motivated, and it does not, it lacks these external rules and structures set by the adults. So play needs to come fully from the inside of the child wanting to do it. So what happens when children play? So the child is able to create and explore a whole world that they can master. And when there is mastery, then there are new competencies that are being developed, and it leads to enhanced confidence and resilience for the future. What are the different forms of play? Pretend play, pretending that you're somebody. So rough and tumble play, so very rough play, active play, creative play, construction play, mastery play where you pick up a new skill, sensory play, you deal with the senses, exploratory play is where you go out and you explore the world around you. So these are the different forms of play. So how does play benefit a child? Play is really essential to the overall development of children, be it physical, social, emotional, and the cognitive needs of the child. So first of all, it develops the social skills in the child. Children learn to develop peer relationships when they play with others. They learn how to work in groups. They learn to negotiate and resolve conflicts. And when they're bullied by their friends and when they play, they learn to advocate for themselves. So secondly, executive function. So executive function is basically the air traffic control tower of the brain. The brain tells the body what to do. We practice decision making. there is discovery of areas of interest, there is self-reflection. So these are important skills to develop for learning in the future. Right, everybody, I hope you've seen this statistics that we in Malaysia, we are one of the most overweight population in Southeast Asia. So 44.2, almost half of our population are either overweight or obese. So this emphasizes the need to let our children play and be active so that they can build healthy bodies. So this study tracked children from the age of 9 years and above for 21 years, right? Then they review them back as adults and whether they're still active adults. So in this slide, it shows that if, in the red boxes, if a child starts to be active between the ages of 9 to 12, if they're active for 3 years, the odds for a boy to be active as adult is 7 times more likely than a non-active child. In females, it's 4 times more likely. And if they remain active for 6 years, the odds actually doubles up to 12.6%, and for females, 7 times more likely to be active adults. So what about the older age group? If the child develops physical activity between the age of 15 to 18, for 3 years, the boys will have 12 times more likelihood to be active adults, girls 4 times more. And if they were active for 6 years, then they are almost 20 times more likely to be active adults. So it's very important to start them young. So for emotional health, so play, especially when it involves a little bit of risk-taking, a bit of danger play, it gives them the opportunity to experience fear, right? They feel scared when they go over the ledge of some height, right? And then they develop the skill to overcome that fear as well. So as the child runs and plays around and be active, the stress gets released from their body, so there's decompression, and the children learn how to control their emotions as well. Then when all of us reflect back on our own childhood, we remember the fun and playful times. So it's really it's a simple joy that is a cherished part of childhood. So next, play increases personal strengths, especially in the form of creativity, in terms of mastery of a skill. Then there is resilience developed and there is self-esteem. So what are the developmental stages of social play? So at 0 to 3 months, a baby learns to discover how their body moves. So there's lots of movement of the limbs and it looks very unoccupied. The next stage should be solitary play. The child plays alone, not really interested to play with others yet. Then at around 2, they begin to watch other children playing. And then they start to play alongside other children, but not together with them. At 3 to 4 years old, there is the beginnings of interaction with others during play, but not an awful lot. And then finally, from 4+ years and above, there is this togetherness, playing together with others. There is interest in both the activity as well as other children involved. Okay, so who do children play with? Of course, when the child is extremely young, at the infancy and toddler stage, they play the most with their caregivers, the parents, the babysitters, the grandparents. And then as the child grows up, the child plays more with their peers and friends. And of course, siblings are a constant in their lives, especially they can play really well together, especially if the age range is very close. So we start with addressing the younger age group, adult play. So adult playing with the infant and the toddler. So the Harvard Center of Child Development describes the principle of serve and return using tennis. So in tennis, you serve, one person serves, and then the other person returns, right? So it forms the basis of responsive caregiving. So this kind of back and forth response is between the adult and the infant. So what happens is the baby serves. Baby starts serving by babbling, gesturing, or crying. And then the adult on the other side responds by giving eye contact, reassuring words, a hug, a snuggle, right? So this kind of back and forth response goes on and on and on between the caregiver and the baby. So neural connections in the brain are being built and it's strengthened in the brain. And it especially supports the development of communication and social skills because this too requires a lot of back and forth, right? So you can imagine putting the child in front of the screen, there's just a unilateral, there's no back and forth, which is why we have so many children with language delay now. And we can also imagine children who are chronically neglected. The parents are unwell themselves or not able to care for the child, and the infant is chronically neglected and ignored. And these messages sent by the baby is never returned. So you can imagine what it does to the brain. So in this slide, this is little Jaden. He's my nephew. This is when he was a baby, and this is my mom playing with her grandchild. So let's see remember the principle of serve and return, right? As I play the video. Baby Jaden serves, and daddy returns. The baby serves again.
Handsome boy.
And daddy returns.
Handsome boy.
Right? And this goes on and on. As you play with your baby, your child, this serve and return keeps going back and forth, back and forth. All right. Okay, so we can see from a very young age, infants actually already start initiating this serve and return, and they really need the responses of the adult to strengthen the neural connections. This is when he's a toddler, about 1+. Okay, so actually this goes on and on. It's the same thing. So we can see baby Jaden actually initiating a serve by throwing the fruit basket onto the floor and expecting a funny response. So grandmother provides this response, and he gets entertained and he laughs, and then he tries to serve it again, right? Okay. Right. So playing with a child is serve and return. So as we pay attention to a child's cues and we respond to their cues, it's really engagement with the child. And paying this close attention, it enables us to see the world from their viewpoint. And it allows us a fuller understanding of their perspective. This is especially important in children who are still very young, less verbal, or they have language delay. They're not able to express themselves with words, so they express through play. Next, we look at the older age group, and I'd like to introduce the concept of adventurous play. So what is adventurous play? It's play with a little bit of risk. It's thrilling and exciting, and there is a risk of physical injury. It can involve climbing up to heights, going on high speed on the scooter or the skateboard, dangerous tools like sharp objects, near dangerous elements like water or fire, and going to places where they can get lost. So adventurous play tests a child's physical limits. And with this exposure, it teaches them to avoid and adjust to dangerous environments and activities. So this next video is the video of a playground next to the Royal Children's Hospital in Melbourne, where I train. So imagine this playground is set up next to the hospital. So it must be hospital approved, right? So look at the playground. Look at how, so take note of the natural elements that's involved. So they don't use artificial materials like plastic or colors, and it's all natural elements. And also, what kind of risk of injury is there if your child is actually there playing on the playground? Okay, I think I'm going to stop the video here. So when I first saw this playground, I thought to myself, how many arm fractures did we have here as an accident site? How many head concussions, twisted ankles? So yeah, so the Australians let their children play risky play. And when I think and reflect about it, did the Australians manage to raise children who are more active and outgoing as adults? Yes, lots of them are active adults. A lot of people are very active in sports, and they've got this great work-life balance going on. And then I thought, did they manage to raise people who are more bold, who have greater risk appetite? Did they nurture more creative people who can think out of the box? Is this all because of play? So I leave these questions for you to ponder. So, as safe as possible or as safe as necessary? Injury prevention is important. It is the key in promoting child safety. But when do we go overboard with things, right? A bubble wrap child is created when risk is completely removed from play and when the restrictions of play is too big. No, don't climb on there. No, don't go there. No, don't, no, right? Then you create a bubble wrap child. So the risk-deprived child is prone to obesity, mental health concerns. They become, they have a lack of independence to make decisions for themselves. There's decrease in learning, perception, judgment skills. So it's important for us to reflect on our approach towards safety. So I will describe more about this risk thermostat model. So this model was described by John Adams in 2001, and it shows that risk-taking behavior is a balancing act. It's a balancing act over here in this diagram that the child is learning and deciding for himself. So we have this toddler, right, at the high point, the height of the slide. And when it comes to the child himself, what is his propensity to take risk? Is he the more risk-taking type? Not so afraid of danger, he will just go, or he's more risk averse, right? Then the second thing is perceiving danger. Is this light too high for me? Will I get hurt? Right? Will I get into an accident? And then the reward. Oh, how proud or accomplished I will feel if I am able to go down such a tall slide. So he's there thinking and balancing this risk and the reward, and he's deciding for himself. So what do the children really want? So studies have shown that children really they intentionally seek out risk in their play. And up to 90% of children desire to play with riskier equipment such as flying fox, space nets, tubular slides, and they want to be trusted with the decision to manage this risk. And it allows them to display their courage and physical skills as well. And when the play becomes too uninteresting and unchallenging, children tend to withdraw and are no longer interested in playing there, right? Okay, so what are the barriers to play? So many in this urban lifestyle of ours, right? So there is obviously a lack of time. We've got working parents who come home and pick up children from babysitters 6, 7 p.m. and then it's dinner time and then it's homework and sleep, right? And then there's also a focus on academic achievement. There's competition to get good placement in good schools. There's a fear of being left behind. And there is a national focus as well on the academic fundamentals like reading, writing, and counting, right? And then there is technology and screen time that's taking away the child's free time to play outside. And then we've got communities and neighborhoods that are just too dangerous. You've got a lot of traffic on the road. You've got crime. So we worry. So children can no longer play as safely as we did 30, 40 years ago. And then we've got enrichment programs. So you've got Kumon, coding, computer classes, art classes, ballet, piano. So these are enrichment programs, and they are taking up the children's free time to play. So a lot of these activities are marketed as being able to stimulate excel development and help them to master some skills. And sometimes it creates a false impression on us that it becomes a requirement for good parenting. And so football mummies spend their time transporting children here and there for classes. And then the family's financial resources are invested for the very best opportunities. So when do we strike the balance? Of course, all these enrichment programs and activities, they have developmental benefits. But at what point is the child overscheduled versus benefiting from these enrichment programs, right? So the lack of downtime, there is a lack of downtime for productive parent-child interaction because a good foundation of parent-child relationship comes from spending time together. But when there's so many programs happening in a child's life, the child's most productive time is used for all these different activities. So most highly scheduled children thrive, and you may be one of them, right? Working in Center of Excellence, we may have been highly scheduled children in the past, but some children are more sensitive and they react to these pressures and they become anxious. They display other signs of stress, or sometimes they have these psychosomatic symptoms like abdominal pain, headache, where we have investigated for everything and we can't find anything, and whether is stress the cause of it. So we need to consider achieving the appropriate balance between preparing for the future and living fully in the present through play. Right. So now I'll move on to the neurodevelopmental disorders and play. So the two common disorders are autism and ADHD. I'll just touch on these two. So in autism, we've got challenges with social interaction, communication skills. They've got this very rigid, repetitive behavior, and sometimes with sensory issues. So their play challenges can involve having differences with imitation, symbolic play, and joint attention. This is because as they play, they are unaware of other peers, other children, or the adults in their lives trying to engage with them, trying to play with them. So when you are so engrossed in your own world, you don't take notice of what is happening around you. If other children are having their pretend play, symbolic play, if other children are playing with their toy train, choo-choo, all the autistic child does is he may be more interested in maintaining order and arranging things in a line compared to actually playing meaningfully with the toy. What about ADHD? So it's a behavioral disorder. There is lack of attention and focus, and they have difficulties controlling their impulses, and they can be very hyperactive. There can be impairment in school performance because they can't focus and learn very well. And then impairment in social interaction. So when they play too roughly, they can't control their strength, or they say something without filtering through their mind first. So this is impulsivity. Then there can be a lot of conflicts, a lot of rejection from peers, and fewer friendships. So therapeutic play in these disorders, play skills, it can be taught, right? And parents can participate and teach their children every day at home with the guidance of a therapist or developmental pediatrician. So challenging areas like the lack of joint attention or language skills, or the play, is it limited because of rigid repetitive behavior, or the developmental play skills is just not according to their age. So these areas are assessed and then targeted and worked on through repetition. So the OT will build the joint attention, can work on reducing sensory issues, and also they have group therapy to build social skills. And speech therapy, if there is limited communication that limits their play with others, then we want to build their language skills. So the last part is, I want to share this quote with you. You see a child play, and it is so close to seeing an artist paint. For in play, a child says things without uttering a word. You can see how he solves his problems. You can also see what's wrong. So seeing what's wrong is the basis of, it forms the basis of play therapy for psychologists. So play therapy is different from therapy that we use through play for neurodevelopmental disorders. It's used to help resolve psychosocial difficulties, emotional problems, and it aims to be a vehicle of change for the children to use play to express their emotions surrounding traumatic events like PTSD, child abuse, chronic illnesses, and also to strengthen play processes. So play therapy has numerous research data, and it's in multiple settings, except, for example, hospitalized children significantly reduce anxiety. Children with leukemia, because they have chronic medical problems in and out of hospital for a prolonged period, they use pretend play, music, art, sand play therapy to engage with these children, and it's shown that it improves physical problems like fatigue, pain, psychological problems, anxiety, despair, or stress. And in ADHD, it can reduce behavioral problems and improve social skills. So my key take-home messages is to think really about the bubble wrap child, as safe as possible or as safe as necessary. And remember, in our busy urban lifestyle, to keep the children having adequate time to play, strike a balance. And remember that play can be used and can be taught in children with developmental disorders and can be used as a therapy for psychological issues as well. So I'd like to acknowledge my brother and his baby Jaden. And one of the videos is from Wonder Village. Thank you very much.
So thank you, Dr. Vien, for that really, really lovely lecture. We actually have a few questions in the Q&A, but so I think I'll summarize it and merge them. But one thing that you mentioned, which is really very important, is that play is a type of form of learning. I think that's really very important that you've emphasized that and the serve and return. One of the questions is about people arguing that if they're successful despite their parents restricting play when they were children, how would you respond to that?
Okay, I would say that I was one of these children, right? So as my point in the slide earlier, most highly scheduled children thrive, right? So every child is different. Some people thrive in these environments and some don't. So we got to think about children who may appear unhappy, children who may have sleep problems or appetite issues or have psychosomatic symptoms that despite investigations have shown nothing. Are these signs of stress? We got to think about the child's mental health. So we got to think about what typology your child is, emotionally more sensitive or deals well with stress or not. So every child is different. And there is also this drive, even as adults, for good work-life balance. Life should not be all about work, right? So it's the same with children. Life in a child should not be all about learning and studying and picking up organized activities and the skills through these activities. They should have that time and space to run around and play as well.
And one other question is, what are the signs of children whose scheduling or enrichment balance has been thrown off? Because sometimes children can't express themselves.
Yeah, I mentioned earlier about all these signs. And I think one of the kind of indicators we've seen children in clinic where parents have brought them to multiple places, like this child Dania with a headache. It's not a real name, by the way. With a headache for 3 years. So mom has been bringing them to see doctor after doctor, and there is investigations done and nothing comes up. So there are these small group of children with these kind of psychosomatic symptoms that we really need to start thinking about whether stress is the cause of it. And yeah, of course, the child's mental health. I think mental health in children is not such a big thing in Malaysia, but it's something that we need to start thinking about. Does the child appear unhappy or very oppositional in everything or defiant? So we got to think deeper, not just look at what is on the surface and discipline children. Yeah.
Yeah, and the other thing is children should have a say as well. That's very important.
Yeah.
I think what you emphasize is. Okay, so thank you very much, Dr. Vien, and thank you to the audience for staying. I will pass over to the next moderator and speaker. Thank you.